I'm Kathleen O Meara and I'm Head of Advocacy and Communications at the Irish Cancer Society. The average additional cost of having cancer and going through treatment are €862 a month, and that's a conservative estimate because for some people it's as high as €1,200 a month, and that's not taking into account loss of income. For those who lost their income, the average loss was €1,400 a month. So as you can see from those figures, the additional financial cost of having cancer and going through treatment is quite staggering, and for some families it's catastrophic. Some people have private health insurance, but that doesn't cover everything. Some people have a medical card, and that's obviously a very supportive thing to have if you're going through cancer. But for some people, they have very little support. Now, we do publish a booklet called Managing the Financial Impact of Cancer, and the Irish Cancer Society also has daffodil centres in all the cancer hospitals and indeed other hospitals as well. And that's there to support people, to give them information, to tell them how to apply for benefits. And there may be social welfare benefits that people are entitled to and possibly don't know about. But what we want to see happening is that cancer patients would have automatic access to a discretionary medical card. Under the legislation, a discretionary medical card is designed to alleviate hardship for people. And what we're saying today very clearly is that cancer patients are definitely experiencing hardship, definitely experiencing financial hardship. And to know that you will get a medical card which would cover GP visits, would cover drugs, and cover a lot of those things in particular would make a huge difference to cancer patients and give them something less to worry about. Now, it doesn't cover everything, but we think it would be an important measure to put in place. We also want hospitals to consider the parking charges that cancer patients have to pay, because the feedback we're getting, and indeed the survey shows it as well, is that parking charges is a big issue for people. We want hospitals to consider giving cancer patients free parking while they're going through their cancer journey. Travel costs, childcare, heating, they're not covered by anything. They're not covered by any scheme. And we know here in the Irish Cancer Society, because so many people get in touch with us, that they are, at their wits' end often. They have to rely on their family, they may have to call on their family for financial support, and that's a very difficult thing to do. So we think there are things that can be done, and we want the National Cancer Strategy, the new National Cancer Strategy, to include some recommendations in this area.